and later I will start at 9
Okay.
your time, and then after the opening video, Dr. Teguh will give an introduction speech.
Yeah,
Okay.
but you manage the connection of my audio and video, or I have to disconnect?
I'm sorry?
I have to disconnect my audio and my video now.
Oh, I can manage that.
Okay, you can manage it. Okay,
Yeah.
thank you.
Okay, see you. I will turn
See you, thank you.
off your video and audio.
Okay.
Hello, everybody. Can you hear me? Can you hear me? Okay. Hello, everybody in Southeast Asia region. Good afternoon, and good morning in Europe and USA. So I'm the president of the International Society of Aesthetic Medicine, Isam. Today, I'm very proud to invite all of you, the speakers, the chairman, and the participant to discuss together about novelty technology. So the topic for today's event is the benefit of novelty soft tissue filler, and this technology is using Seffiller. Seffiller is the novelty technology for grafting the fat using very brilliant and very easy tools to get the filler. And this technology was found by Dr. Alessandro Gennai. So today, of course, I will introduce you two very important and very famous gentlemen. The first one is the chairman of this event is Dr. Lan Leong Chung from Malaysia. He is very famous and he is very interesting in fat management of human. So he will assist Dr. Alessandro Gennai, which is the speakers in this event. And Dr. Alessandro is plastic surgeon from Italy, of course. So Dr. Lan later will explain more detail about Dr. Alessandro. And of course, I'm very happy and very proud to get Dr. Alessandro Gennai, who is the inventor, who is the founder of this novelty technology of soft tissue grafting, using fat grafting, and of course, it can be used for volume correction. So once again, as many times I explained to all of you, please remember, always use evidence-based medicine material, cosmetics and cosmeceuticals, and technology. And don't forget also another important thing, as a doctor in aesthetic medical field, you have to be well trained before you use it for your patient. Okay, so last but not least, I welcome to all of you and enjoy our event. Please be networking in this International Society of Aesthetic Medicine, which is Dr. Alessandro Gennai is also the officer, the committee in Italy of this society. The president is Dr. Rosalba Russo. And I also would like to invite all of you all over the world to be connected in this society. Okay, now Dr. Lan, please take over this event.
Hi, good day. Good day, everyone. Nice to meet you all again. So to this, thanks a lot, of course, for this international webinar organized by the Isam, International Society of Aesthetic Medicines. So in the past and then in current and future, in the future, I would say a lot of regenerative medicine, integrative medicine, have a lot of doctors have started practicing. So what is this about? Even though some of us, we don't practice, I think it's a very, very good for us to learn the knowledge, to get the latest technology, and then I am sure in the future, this regenerative medicine definitely is a very, very important practice in all the medical field. So beside the normal standard medical practice, so today, I think I will cut short my speech, and then I direct introduce the most important speaker today, Alessandro Gennai, which is from, I would say, from Italian. He is the plastics, reconstructive and aesthetic surgeon and board certified in the general surgery. He's also the inventor for this device, which is a safe device to practice as a minimal invasive procedure. I think today's topic, the benefit of the novelty soft tissue filler treatment with the autologous fat filler, cell filler. So if any question during this presentation, try to note down and start to key in your question in the Q&A. Don't wait until the last minute. During the Dr. Alessandro start to present, if you have any question, please start to type in the Q&A there. So we'll start to answer you one by one at the end of the presentation, because this is, I would say, is an interactive you should ask the question to learn more. Not only, I think, the doctor to introduce a product or introduce a technique. I think it's most important. It's a time for all of us to learn the integrative or regenerative medicine. So with this, I think let's welcome our speaker, Dr. Alessandro Gennai from Italy. Yep.
Okay.
Dr. Alessandro.
Okay, you can hear me? Hello? You can hear me? Okay, great.
Yes, we are hearing you. Please go ahead.
Thank you very much for this invitation. It's a great pleasure for me to participate to this important webinar of International Society of Aesthetic Medicine. Thank to my friend, Dr. Teguh, and the colleague, Dr. Chung. And it's a real pleasure for me to share with you the new age of regenerative aesthetic medicine. Now I'm going to share my screen so you can see my presentation. Please give me the host disabled attending screen sharing. Please, the authorization to share the screen. Please, because I cannot share my screen now. Okay. Okay, thank you very much. Thank you very much. Now, okay. Okay, you can see that one. Okay, you can see well my presentation. Now I can try to wait a moment that. Okay. Okay.
At the bottom, there are some.
Yes. Yeah, sharing now. Okay, that's it. Okay. The topic of my presentation, as the introduction of Dr. Chung and Dr. Teguh, is the Seffiller technique. The Seffiller technique comes from my technique SEFFI and micro-SEFFI, the superficial enhanced fluid fat injection. And again, that opened the new age of autologous aesthetics or regenerative medicine. When you talk about the Seffiller regenerative procedure, this procedure is actually a real something new in the world of aesthetic medicine. And the Seffiller regenerative procedure is now the most powerful and safest anti-aging tissue treatment. For me, the safe is an important issue when I perform my procedure. Seffiller regenerative procedure is the safest procedure for our patient, but also for us, because it's an autologous, homologous, microfragmented adipose tissue graft. And it's a cosmetical, minimally invasive procedure. So remember that this procedure is a fat graft. It's an autologous, microfragmented adipose tissue fat graft. And so the power of this procedure, as you can see, is in the inside, there is the stromal vascular fraction. And now I'm going to explain this, this concept. As you know, the main factors involved in facial aging is the aging of the skin and the loss of volume. And when you perform the regenerative procedure, you are going to correct these two issues. And so the Seffiller regenerative procedure is a microfragmented adipose tissue graft and leverages from the power of stromal vascular fraction and mesenchymal derived stem cells that is naturally present in the adipose tissue. So the goal of the procedure is to regenerate the skin and restore the volume. But not also is a new age of aesthetic medicine, but I think that open real golden age for aesthetic market. As you know, as you can see from this plastic surgery statistic report from the American Society of Plastic Surgeons, the cosmetic surgical procedure, unfortunately for me that I'm a plastic surgeon, is decreasing is 5% every year. In the other hand, the cosmetic minimally invasive procedure is increasing more than 200% every year. And the regenerative medicine market is growing very fast all over the world. But in particular, in the Asia-Pacific market, reached the $6 billion US, and the compound annual growth rate is 20%. So it's extremely important market, the regenerative aesthetic medicine market. But when you talk of the Seffiller regenerative procedure, we don't think only a classic fat graft of the or lipofilling or like this, because there is the Seffiller regenerative procedure is a real tissue graft, and not merely a fat graft. The reason is because when you consider the adipose tissue cluster, in the adipose tissue cluster, you have not only adipocytes, but you have also very important other cells that compose the stromal vascular fraction. And the stromal vascular fraction, you can find the stem cells, the adipose-derived stem cells, the fibroblasts, the pericytes, the preadipocytes, but also other important cells for the tissue health is a granulocyte endothelial cell and hematopoietic cells and monocytes and lymphocytes. So it's important to understand when you perform a microfragmented fat graft, you are doing a tissue graft. And another important concept is that when you perform a regenerative therapy, it's important the dose of tissue that you are going to inject. And for this reason, in this slide, you can see that in 1 ml of adipose tissue, you can find more or less 500,000 to 2 million cells of the stromal vascular fraction. And remember that an average of 1 to 10% of the cells of the stromal vascular fraction are adipose-derived stem cells, mesenchymal stem cells. So when you have an adipose tissue cluster, you are grafting the adipose tissue cluster, sorry, you of course, you are injecting stromal vascular fraction, and then you are injecting also stem cells. And the property are differentiation, because these stem cells have the capacity to transform in adult mesenchymal stem cells as adipocytes, but also chondrocyte and osteocyte. And for this reason, the regenerative therapy is so important, not only in aesthetic medicine, but also in other fields of medicine, for example, in orthopedic and gynecologist, in general surgery, vascular surgery, and so on. Another important thing that in the stromal vascular fraction, you can find fibroblasts. And so you have the production of collagen and glycosaminoglycan, very important for the skin healthy. Also, you have angiogenesis activity because you have vascular endothelial growth factor, and so you increase the vascularity of the subcutaneous tissue, and so you have a very important anti-aging effect. You have the capacity of homing. The homing is the capacity of the stem cells and the cells of the adipose tissue to move where the tissue needs to healing, the antifibrotic activity and immunomodulating activity. So all these properties make this procedure to have as effect an enhancement of volume of tissue, because I told you that the stem cells have the capacity to transform in adipocytes. And so you have to, restore the volume that during the aging procedure you are going to lose. And of course, you also enhancement of skin and subcutaneous tissue quality, thanks to the activity of the fibroblasts, the activity of the collagen, the glycosaminoglycan, the activity of the angio activity with the growth factor, endothelium growth factor, the antifibrotic activity. For this region, these regenerative properties make Seffiller the most innovative and powerful aesthetics treatment. As I told you at the beginning, the mother of Seffiller kit, the Seffiller procedure, is Seffi and microseffi procedure. This procedure, I standardized and published the procedure in 2015 and 2016 in Aesthetic Surgery Journal and in JAMA Facial Plastic Surgery. And the concept of the Seffi and microseffi procedure is that it's very simple. The concept is that before this procedure, the surgeon harvests the tissue with big cannula, and so he harvests the big cluster of adipose tissue. And for this reason, to obtain a fluid tissue to inject, you have to manipulate this tissue to reduce the cluster of tissue. The concept of Seffi microseffi is the using of the very thin cannulas with very thin, very small hole side pore soles, and so you are going to harvest the right dimension, the right cluster dimension in the harvesting procedure. Of course, the smaller the side pore soles we use to harvest the tissue, the smaller cluster you obtain. And so, if you have a smaller cluster, you obtain more fluid tissue. But why is so important to have fluid tissue? Because the main thing when you do a regenerative procedure is to inject the tissue as superficial as possible. Injecting the tissue in very superficial layer under the skin, in the subdermal layer, and sometimes in the dermal layer, is extremely important to enhance the capacity of this tissue to have the regenerative to restore the volume, but also to regenerate the skin. And for this region, is mandatory to inject the tissue extremely superficially, in the superficial layer. And for this region, of course, you need a very fluid tissue. And with Seffi and microseffi, you obtain a fluid tissue from the harvesting procedure. And so you don't need any manipulation. And so your tissue is extremely, having a very high rate of cellularity and stemness. And the three main things that is extremely important to have a fluid tissue is because if you have the fluid tissue, you increase the engraftment rate, increase the regenerative effect, and obtain wider indication. Now we are going to explain all these issues. First of all, why, if you have a small cluster, you have an increase in engraftment rate? First of all, because in a small cluster, all the cells improve contact of the wall cells. And so you have the more, you have a higher engraftment rate. If you inject a big cluster of tissue, the inner cells go to necrosis because they have any contact with the surface. And more, of course, it's very understandable. If you inject a small cluster very superficial, you can have some lumpiness or irregularities in the skin. Other two important reasons because we have to inject very superficial, because injecting superficial, you are injecting the small cluster in the layer where there is a vascular net, a very effective vascular net. And so you improve the vascularization. And more and more and more, when you inject the small cluster very superficially, you improving the effect of collagen and glycosaminoglycan production of fibroblasts. And last but not least, when you use the fluid tissue, you obtain wider indication when you inject in the face. Because as you know, in your face, you have a different thickness of the skin and different thickness of the subcutaneous layer. And so, as you know, for example, in periocular area, you have very thin skin and you have almost nothing of subcutaneous tissue. In the other hand, if you inject in the malar and zygomatic area, you have a thicker skin and you have more subcutaneous tissue. And so when you have a superfluid tissue to inject, you can inject all the area of the face without any risk of irregularities and lumpiness. The best site of selection of the tissue. Anyway, I think that there is not a big difference of the harvesting area. I think that the best thing to ask to your patient where she prefers to harvest the tissue. Anyway, I think that the most common area with fat depot is the abdomen and the trochanteric area. Of course, regenerative therapy is an innovative technique and so require validated studies. For this reason, in my practice, I collaborate with the stem cells in Bologna, Italy, and with the SEFFILINE USA Corp in Miami, in US, for research and innovation. And so we proved and published a great amount of articles about this issue. We proved that the cells, there is a good amount of cells of stromal vascular fraction and adipose stem cells in the different kind of tissue. We proved the capacity of the stem cells to form colonies, because when you have a stem cells, you have to prove that this stem cells have the capacity forming colony in order to transform in adult mesenchymal stem cells. Moreover, we proved in a very interesting study that we published in 2018 that these mesenchymal stem cells have the capacity to transform in adipogenic, osteogenic, and chondrogenic cells. Of course, as I said before, it's extremely important to know the amount of cells we are injecting when you perform a microfragmented adipose tissue graft. And for this reason, we evaluated the number of stromal vascular fraction cells and adipose-derived stem cells for ml of adipose tissue in graft. But the reason why we moved from the Cephi and microcephi to Seffiller was because when I have my presentation during the aesthetic congress, aesthetic medicine congress, the colleague loved this procedure. But actually, the Cephi and microcephi procedure are surgical procedures, are minimal invasive but surgical procedures. But I strongly believe that regenerative aesthetic medicine can also be performed by aesthetic doctors. And for this reason, I try to standardize a technique that is meant for aesthetic doctors, and so without any surgical skill. As you can see in this short movie, the Cephi and microcephi procedure is a minimally invasive surgical procedure, but actually is a surgical procedure, and so requires surgical skill, because the harvesting procedure is a quite micro liposuction. The Seffiller, in other hand, is a medical procedure. Thanks to the special patent guide, it doesn't require any surgical skill. And now I'm going to introduce you this special guide. This special guide is an Italian patent, my Italian patent, and the guide is designed to make the procedure easy, safe, effective, and standardized. This is very important things to do this procedure in very easy and safe way in your without any need of surgical skill without any need of a surgical room. The concept is very simple. When you introduce the special cannula inside this, this guide, the cannula is far from the guide, the blade, 15 millimeters, and come from the blade other 15 millimeters. This, when you introduce the cannula, you have to do, after that, I show you a video procedure, and so it's very easy to understand the procedure. But anyway, you have to perform a little hole in the skin with a needle, a 18-gauge needle, and then introduce the cannula. When you introduce the cannula, up to the stop of the guide, and you are sure that your cannula is inside your patient no more than 15 millimeters. It prevents any risk insert the cannula too deeply. And so without any surgical skill, you can introduce your cannula in a very safe way. After that, you turn 90 degrees your cannula under the skin, and your cannula is 15 millimeters from the blade of your guide. And it grants to harvest the tissue in the correct plane. When I told you correct plane, I told you the correct plane for the safe point of view, because you are sure that you are in a superficial layer, and so you have any risk to touch the fascia, the muscular fascia, or other organ, deeply organ. But when I said you the correct plane, I also think the plane where you can yield the higher amount of stromal vascular fraction and stem cells, because we proved in several studies that harvesting tissue in very superficial layer, this adipose tissue is richer in stromal vascular fraction cells and then in adipose-derived stem cells. The concept is the cells of the stromal vascular fraction are around the small vessels in the of course of the little vessels in the adipose tissue. And so when you harvest the tissue close to the subcutaneous tissue, you have more vessels, and so you have more stromal vascular fraction cells and then more stem cells in this fat graft. As I told you, this guide is designed to make the procedure extremely easy, safe, effective, and standardized. And for this reason, we study all the particulars that make this guide the harvesting tissue without any surgical skill. For example, there is a little hole where you introduce the cannula, and it avoids any cannula bending on syringe when during the procedure, because as you will see in the video procedure, when you harvest the tissue, you have a small movement in a fan way, and so you have to move the cannula under the skin. And when you have the cannula through this hole, it prevents any bending of the cannula. Moreover, you have a very large blade. The large blade avoids any guide bending over the skin surface, and so it's very easy to maintain the contact of the blade to the skin. And so, again, without any surgical skin, you are sure that you are harvesting the tissue in a correct plane, in subcutaneous tissue plane. Last but not least, in this guide, you have a line marked on the blade, and it indicates the maximum extraction of the cannula during the procedure in order to tip the cannula holes inside the skin incision. Of course, if you make the hole outside of the hole of the skin, the cannula lose the aspiration, and so you cannot harvest the tissue. So with this line, indicate the maximum extraction of the cannula during the procedure. In the Seffiller kit, there is also another important concept. In the Seffiller kit is all-in-one. In your kit, you find all you need for the procedure, from the harvesting to the injecting procedure. So you can find all the material that you need in your facility to do the whole procedure. The syringe that you have to use during the harvesting procedure is this special syringe that have the auto plunger lock. This is extremely useful because when you go to aspirate the tissue, you don't have to maintain the plunger with your hand, and so the plunger is have an auto plunger lock. Another important thing is the special cannula. The special cannula have the special side port sole that select the small cluster of the adipose tissue, and so you are sure that you don't need any manipulation of the tissue after harvesting, but also have a special connection, a special polymer connector to the syringe, and for this it guarantees the maximum aspiration of the cannula. Now, I share with you the video procedure, and so I'm asking to the okay, now perfect. Now, okay, I hope you can see the video. Okay, first of all, you know that as I told you, inside the kit you can find all the items, all the material that you need for the procedure. You inject a little amount of anesthetic solution. Then with the needle, the 18 gauge needle, you can make a little hole in the skin. For example, the needle is inside the kit. The 15 gauge needle is inside the kit. After that, you insert the cannula in the syringe with anesthetic solution. You lock the syringe in the guide, and so you are going to inject the anesthetic solution in the fat depot area. It's very easy. The introduction, you maintain the blade in contact to the skin and inject the anesthetic solution in a funner way, very slowly. Is absolutely painless, this procedure. After that, you have to wait 10 minutes just because the adrenaline work. And after that, with the same cannula, the same syringe, and the same guide, all is inside the kit, you start the harvesting procedure. Insert the cannula in the hole up to the stop of the guide, insert the cannula under the skin, maintain the blade of the guide touching the skin. As you can see, you lock the plunger. Now the plunger is locked, and so you don't have to maintain with your hand. And then you start to gently move back and forth under the skin, and you can see very well the tissue that is coming inside the syringe. You have the line marked on the, and so now you extract the tissue. You can see the tissue in the syringe. Now you transfer this tissue in another syringe. The transfer is inside the kit, the other syringe is inside the kit, everything is inside the kit. In the transfer, there is any filter, you don't need any filter, nothing. You have your tissue. After that, you fill it up your syringe with saline solution. You cap the syringe, everything is inside the kit, the cap, and put the syringe in the syringe holder that is, of course, inside the kit. And start with another syringe and repeat the procedure until you obtain the tissue required. After I will explain you, the average tissue that you require in this kind of procedure is from 4 to 15 cc. Okay, as you can see, the procedure is exactly the same, is very easy, very safe, and fast. You have tissue in the syringe, you do the same procedure, you transfer the tissue in the other syringe, and after that, you fill it up the syringe with a saline solution, cap the syringe, okay, fill it up with saline solution, cap the syringe, and put in the syringe holder. After a few minutes, you can see that there is a separation, the tissue from the washing liquid. You have only to discharge the washing liquid. You discharge the washing liquid and maintain the tissue inside the syringe. Very easy, very safe. Everything is inside the kit. All the syringe, you discharge the liquid, and you maintain only the tissue in the syringe. Okay. You can see the tissue is microfragmented adipose tissue with the right dimension of cluster, and so you don't need any kind of manipulation. Okay, the last one, syringe. Now I suggest to transfer all the tissue in one syringe, so it's more easy to manage. So now I'm transfer all the tissue that I previously washed. I transfer in one syringe. Okay. For example, in this treatment, I have more or less 10 ml of tissue to engraft. Okay, the last one, I transfer the tissue in the syringe. And so you have a big amount of tissue. After that, I make some passages are performed from one syringe to another, just to fluidify a little bit the tissue, and the tissue is ready to inject. Before to inject, I suggest to transfer in a smaller syringe. The smaller syringe is inside the kit, just because it's more handle to inject the tissue with a small syringe. And now the tissue is ready to inject. You can inject with a needle, you can inject with a micro cannula, you can use what you prefer, needle or micro cannula. Sometimes I prefer cannula, sometimes I prefer needle. It's up to it's your business about what you prefer anyway. Okay, you transfer all the tissue in smaller syringes, and then you can go to inject this microfragmented adipose tissue. Remember this, okay, the video procedure, you can stop the video procedure and we can share again my presentation. Okay, I shared the, let me check. Share, oh, where is? I don't find my presentation. Okay, that's it. Okay, as you can see, this procedure is extremely easy, is extremely fast, but first thing first, is extremely safe. This is some results. As you can see, we are going to correct the main processes in facial aging. The quality of the skin, the increasing of the quality of the skin, and increasing the volume. And so in this case, you are increasing the quality of the skin, increase the volume. You can see in this patient, 1 month post-op, 4 months post-op, 6 months post-op. Oh, sorry, I can go back so you can see. Let me check. No, I try to go back. Okay, perioral area. You can see the incredible, the very incredible increasing enhancement in the quality of the skin. In this case, for example, I inject very superficial. For example, when you are going to treat the barcode, after that, I will show you the protocol, for example, with the dermapen or with the microneedling. It's extremely interesting, and I inject very superficial. In this case, I use needle because I want to inject the microfragmented fat graft in the dermal layer. Again, this patient, after 36 months post-op, you can see the enhancement in the quality of the skin, the terrific enhancement in the quality of the skin. In this case, again, when I told about regenerative Seffiller procedure, I stress the concept that is more important constancy than volume. It's not important to feel too much volume. It's important to educate your patient. This is a kind of therapy. And so you have to do this therapy, of course, at least one time a year, but the average is 2-3 times a year. And so your constancy is more important constancy than volume. This patient, you can see in the first picture, the patient is 13 younger than the last picture. Okay, Seffiller is a medical procedure. As I told you, in 1 ml of harvested fat tissue, you have an average of 150 to 100,000 cells of stromal vascular fraction. And so, as I told you, the minimum amount of tissue that you inject in a Seffiller procedure is 4 ml. Hence, the cells dose that you inject with 4 ml of microfragmented adipose tissue graft is around 800,000 cells of stromal vascular fraction, a very good regenerative treatment. The treatment program depends, of course, on the patient tissue condition. The average is 2-4 treatments per year. Now I'm introducing you what I call special protocols, because of course Seffiller, you can combine Seffiller with other medical procedure with an incredible result. For example, you can combine the Seffiller procedure with hyaluronic acid. Of course, we tested in one study. There is an interesting study that is publishing this year, where we tested 3 different kinds of hyaluronic acid, and we proved that all of them boosted the adipose-derived stem cells growth rate. And this is very important. But the concept is why I have to combine the hyaluronic acid with the Seffiller. The concept and the ratio of this procedure you can find in this chart. I have sometimes some patients, my patient that said, okay, doctor, I'm very happy of the Seffiller procedure. I believe in regenerative therapy anyway, but the next week I have a very important party, and so I need some volume. And in this case, I suggest you to combine a little bit of hyaluronic acid. Because as you know, hyaluronic acid is a cosmetic procedure, of course, have no any regenerative capacity, but have a volumizing effect in the short term. And so you can inject in the same session, you can inject hyaluronic acid for the short-term volumizing effect. As you know, after a couple of months, the effect of the hyaluronic acid is going to disappear. And in the other hand, you are increasing of the volume from the Seffiller procedure, because the stem cells inside the fat graft that you injected transform in adipose cells. And for this reason, when the short-term volumizing effect of hyaluronic acid disappear, we have the volumizing effect of the stem cells in the fat graft. For example, this is a patient. You can see this is let me check the post-op. You have a 4-month post-op, and after 4 months, the volumizing effect is comes for sure not from the hyaluronic acid, but from stem cells. But this patient asked me to have a short-term volumizing effect after 1 week for an important party, and so I combine in the first session the hyaluronic acid and the Seffiller procedure. Okay, you can hear me, I guess. Okay, this is another case. You can see after 6 months, you have a very good enhancement of the skin quality, but also an enhancement of the volume. Another important protocol for me is the protocol and the association with the microneedling. For example, when you have the barcode of the upper lip or the perioral area barcode, the combination of microneedling treatment or also laser resurfacing anyway, you have a very good result. Because when you perform the microneedling, the growth factors flew the area and upregulated the fibroblast production and activity. And of course, you combine this stimulation with the injection of the stromal vascular fraction in the dermal layer. In this case, as I told you before, I prefer to use the needle because I inject in the dermal layer, because for me it's extremely important to inject fibroblast in this skin layer to enhance the production of fibroblast and glycosaminoglycan. My protocol in the first session, I performed Seffiller and microneedling, and after 10 days, I perform other 3-4 microneedling treatment every 10 days. This is some result. You can see after 6 months, you have a very severe skin aging in the malar area of this patient. And after 6 months of treatment with Seffiller and microneedling, you have a stunning result and a very good enhancement of the skin quality. Again, this older patient with with a barcode, very aging of the perioral area, and you have after 1 year, you have an enhancement of the quality of the skin. Again, in this the perioral area. But for me, the king of the association with Seffiller is threads. Because as I told you, the main factors involved in the facial aging is actually the loss of volume, skin aging, but sometimes also the descent of tissue. And for this reason, when you combine Seffiller with the threads, you obtain, as I call medical lift. The queen of this procedure is my colleague and great friend, Rosalba Russo, she's a master in the threads. And when she performed the Seffiller combined with threads, obtained the medical lift with a great and stunning result. Of course, why I call the procedure medical lift? Because the Seffiller correct the loss of volume in the skin aging, and the threads correct the descent of tissue. And so with this two procedure, you can do in your facility without any surgical skill and stunning medical lift. The procedure, Seffiller, usually you inject the Seffiller in a superficial layer, the threads in a little bit deep subcutaneous plane. But anyway, there is two kinds of procedure. There is one-step and two-step procedure. I suggest when you have to treat in the same area Seffiller and threads to perform the procedure in 2 steps. Before inject Seffiller, and after it's enough 1 week, you can perform the threads. When you have to treat a different area, you can do the procedure in 1 step, because you inject your Seffiller in the area required and you perform the threads in another area. You have 2 examples. This is 2 patients from Dottoressa Rosalba Russo. In this case, this patient needs a extensive Seffiller in all over the area. You have to correct with the threads, the descent of tissue. And so this patient is a typical patient that is better to perform the procedure in 2 steps. In this case, the patient have to perform the Seffiller procedure only in the malar, zygomatic, and perioral area, and threads in the jawline. And so you can do the procedure in the same session. And so in 1 session, you have this incredible results, thanks to the ability of Dr. Rosalba Russo. Of course, I have to say you also the backside of the coin, but I want to underline this concept. The risk for injectable treatment in the face is the same when you inject microfragmented tissue graft, but it's the same when you inject, for example, hyaluronic acid or another fill. The risk is only one, is the embolization of the arterial branches. This risk is extremely uncommon, but you have to pay attention because, of course, is the only risk that you can encounter when you do this kind of procedure. But remember, it's not the problem only for the microfragmented fat graft, but is the same problem for all kind of filler that you are injecting in the face. The first thing is to know very well the anatomical basis of the branches of facial arteries, just to know where are the danger zone. In the face, the danger zone area are the glabella area, the nose area, and the nasofold, the nasolabial fold close to the alar rim. My suggestions to reduce the risk of this very uncommon problem, but you have to know that it could be this kind of problem, is first of all, at the beginning, avoid treatment in the danger zone. The second suggestion is if you want to inject this area, before the injection, inject a solution with 1 to 100,000 adrenaline, just to have the vasoconstriction, and so we reduce the risk to embolize the artery branches. Prefer the linear technique to inject and not bolus injecting technique. And then this is very important, more when you inject the tissue. If the needle or the cannula clogged, don't force the plunger. Change the needle, change the cannula, and start again to inject. In conclusion, the Seffiller is the unique device for regenerative medicine meant for aesthetic doctor without any surgical skill. Thanks to this guide that permitted to perform this procedure in a very safe, easy, effective, and standardized way. The second important thing that is a all-in-one kit. You can find all you need for all procedure inside this disposable all-in-one kit. And so you can find everything in this kit. And so you can do this procedure, this therapy in your facility without any surgical skill and without any surgical room. Another important thing that in a Seffiller procedure, you are using the Seffi and micro-Seffi cannulas. These are special cannula. This is a special cannula that have a special side port salt that selects a small cluster. Hence, you don't need any manipulation of tissue. And so the tissue, when you extract the tissue is ready to inject. Last but not least, When you harvest the tissue with this special guide, you harvest the tissue in a very superficial layer. And the tissue harvested in a superficial layer is richer in stromal vascular fraction and stem cells, yielding an average of 150,000 to 250,000 cells of the stromal vascular fraction. But remember, this is a microfragmented fat graft, and the stromal vascular fraction and stem cells are inside the cluster of microfragmented fat graft tissue. As I told you, this is autologous and homologous regenerative treatment. The tissue is not or minimally manipulated, and harvesting procedure is not a liposuction, but a step of tissue selection. Of course, thank you again to my colleague and my friend, Dr. Teguh, Dr. Chung, and I hope that I invite you to the upcoming webinar that I get that International Society of Aesthetic Medicine is organizing shortly. This will be a webinar about the Seffiller. The Seffiller is a kit designed for regenerative hair loss therapy. Of course, now I'm ready to answer to your question, and I hope that this presentation will be useful to introduce you to the new age of regenerative aesthetic medicine. Thank you again.
Thank you very much. Thank you, Dr. Gennai, for the fantastic presentation. I think you have done a very great job. You have made all this what is so-called a complicated aesthetic procedure, which you usually talk should be done by the plastic surgeon or most well-trained surgeons from the fat, we call it as a liposuction, and then with the fat grafting. Now we move on to the very, very minimal, simple procedure. So thanks again, Dr. Gennai, to make all this procedure. I'm sure after this, your presentation, there'll be thousands and thousands of questions for those doctors who actually already practicing this so-called fat grafting or a minimal invasive procedure. So I think we have a lineup of questions for you, Dr. Gennai. So again, once again, thanks because you have already made this procedure moving from an aggressive major procedure, now turn it become a very simple office-based procedure, which most of the aesthetic practitioner actually can start to do so. That's why I think this, after your presentation, I just realized this is a medical procedure. It's not a product. It's a medical procedure. Okay, so for those participants who actually attended, please start to pull up your questions. So if not, then we will proceed with one by one. So there's one from the doctors asked, can we do this in the clinic with the less pain and less blood?
Okay. Of course, you can do this procedure in a medical facility or in a medical facility. You can see me, okay?
Yeah, definitely.
Okay. You can, of course, you can perform this procedure in a clinic, but I think that is not actually is not necessary. Anyway, this procedure is extremely painless. You have to inject only a little amount of anesthetic solution. And I perform this procedure in my medical facility without any problem, because you have to inject not more than 10, 20 ml of anesthetic solution. And after that, the harvesting procedure is extremely painless and bloodless, because you are injecting the solution with a little bit of adrenaline, and so you have a vasoconstriction. For this reason, you have to wait 10 minutes after you injected the anesthetic solution. After that, the injection in the face is the same when you inject a hyaluronic acid or another filler. and I don't think that is necessary to go in the clinic. But anyway, if you prefer to go in the clinic, you can do, of course.
From what the procedure has seen just now, you showed the video. Are you putting in the pure lidocaine with adrenaline, or are you prepared in the tumescent form? And what is the ratio you are putting in? Are you injecting 10 ml and harvesting 10 ml of fat?
Okay. With the kit comes with a video guide where I explain also all the anesthetic solution preparation. And so it's very easy. And I suggest to use lidocaine 2% and adrenaline 1 to 100,000%. In the video, there is all the procedure to prepare this solution. It's extremely easy, and you can prepare in your facility. After that, when you harvest the tissue, you have only to washing the tissue just to wash out the anesthetic solution. But as you can see, you have seen in the video, is extremely easy and fast, because after 1 minute more or less, there is a complete separation of the washing liquid into the tissue. After that, the tissue is ready to inject.
Yeah, from what the procedure we have seen, this is not the standard liposuction procedure where we use usually is a super wet method. More look like it's a dry lipo aspiration. So the next question, any pre-test or post-test you need to do for the patient before the procedure? Dr. Gennai?
Sorry, could you repeat? I cannot hear very well.
Yeah, any pre-test or post-blood test, do you repeat or do it for the patients?
Absolutely not required. Absolutely not required. And
any bleeding profile we need to take care?
No, you don't need any kind of blood work before the procedure. I repeat, the procedure is a minimally invasive procedure, and there is no problem or risk of bleeding, because the tissue is harvested in very superficial layer, and you don't need stitches when you stop the procedure. It's enough a little band-aid on the hole and nothing more. But absolutely, you don't need any blood work before the procedure.
Yeah, I totally agree with Dr. Gennai regarding the patient's side. I think is not necessary, but for the medical staff, I think it's the best for most of the doctor. We need to do the blood test just for our the procedure safety, because it still is a blood product. So like the infectious disease screening, I think most of the center they do screen for that. Yeah,
I'm completely agree with you. The important thing is this one. For example, the blood test, I think that could be useful, okay, for safety of the procedure, but I don't think that is useful for the safety of the procedure. It's important to understand the healthy condition of the patient. For this reason, for example, if the patient is a diabetic patient, you are expecting to have less stemness in the fat. Why? Because as you know, for example, a diabetic patient have a problem in the circulation. And so for this reason, I'm expecting that in the adipose tissue cluster, you have a smaller amount of stromal vascular fraction. And so, for example, in the diabetic patient, if I need to do the diabetic patient, my program is to do 1 time more, for example, in 1 year, not 2, but for example, 3 or 4 times in a year, because I'm expecting that in hair tissue, there is less stromal vascular fraction. The same thing for heavy smoker patient. Heavy smoker patient have a problem in the circulation. And so I'm expecting that the stromal vascular fraction inside the adipose tissue is less amount in compare with the healthy patient. For this reason, I think that could be, it's important to know the healthy condition. But from this point of view, I think that for all doctor, also for the other treatments, it's important to know the condition, the healthy condition of your patient anyway.
Yeah, for the next question by Anita, Dr. Anita, I think regarding the embolism, I'm sure in the presentation, Dr. Gennai already answered quite clearly. So for any of the procedure, of course, we do have the risk of embolism. Do you suggest using the big cannula is actually cutting down the risk of the embolism, Dr. Gennai?
Okay, in the recent studies, we proved that actually more than, okay, for embolism, of course, if you use a bigger cannula, is better than a smaller cannula because the bigger cannula have less risk to make embolism. But I want to underline one thing. In the recent study, they proved that a lot of time, the problem of ischemia from an area or skin area comes from the compression of the material to the vessel. And so remember, one of the most important things, of course, using a bigger cannula is better than a smaller cannula, but the other important thing, and don't inject a big amount of tissue, a big bolus of tissue. Inject in linear way a little amount. As I told you, is more important constancy than volume, because the big amount of tissue can create tissue or material. The same thing for hyaluronic acid. A big bolus of, for example, hyaluronic acid can do a compression of the microvessel and so create the ischemia in the area, in the skin area. So I suggest bigger cannula, perfect. And the second thing, use a linear technique and don't inject a big amount of tissue.
Yeah, I think Dr. Gennai, a lot of doctors here have a bit of question. What is the difference between your SEFFILINE as compared to the classic fat grafting in the past? So what is the difference between your medical procedure, this SEFFILINE, as compared to the classical fat grafting post-lipo?
Okay, perfect. Okay, I try to compare, for example, Seffiller with the classical fat graft lipofilling from Coleman, just to have the two techniques. As you know, the lipofilling, the fat graft from Coleman, considered to harvest the tissue with the liposuction cannula. After that, to inject very deep the tissue in some area. Which is the problem of this procedure? Okay, for me, Coleman is a great surgeon, and in the 90 years, he presented to the world that to rejuvenate the face is more important to give volume than to tie the skin. And for this reason, open a new age of the facial rejuvenation. But talking about the technique, when you perform the classical lipofilling, you are injecting a tissue with a big fit adipose tissue cluster, because you harvest the tissue with a big cannula, with big side hole cannula, like the cannula for liposuction. And for this reason, you have to inject very deep to avoid the lumpiness and irregularities. Moreover, when you have this kind of tissue, you cannot inject, for example, the periocular area, the perioral area, because of course you risk the lumpiness and irregularities. Injecting the tissue so deep, you have the problem that you are losing the skin enhancement, the regenerative effect, because the fibroblast is so far from the dermis, and so the collagen and glucosaminoglycan cannot work on the skin. And so you have only the volumizing effect, but you are losing the effect of the skin quality enhancement. Last but not least, the classical lipofilling procedure is a surgical procedure. And for this reason, only a doctor with a surgical skill can perform, because their vesting procedure is a kind of liposuction. The injection is a very deep injection, And so you have to know very well the deep plane of the fascial area.
Yeah. I think the classic fat grafting, the procedure is more aimed for majority is for volumization. So the large volume of the fat will be injected. And then, of course, it do have the regenerative medicine. So if I look at this cell filler, from what we can see, this is more towards like tissue SVF. We call it as a tissue SVF. It's not a cellular SVF. So when we inject this tissue SVF, we need to be more superficial. Main issue is for regenerative effect of the skin quality. It's not a volumization. Like what Dr. Gennai had presented earlier, if you look at the slide, he always mentioned the 2 to 3 sections. If the patient is willing to do repeatedly, then after a year, you can see more volumization effect. So that I think is the difference between the cell filler and the proper fat grafting. Fat grafting usually 1 or 2 sections, we need to volume up the whole things. But this is more toward the skin quality and regenerative effect. This is, I think there is a difference between these two.
I completely agree with you. And I wish to underline another thing. When, of course, now, for example, there is other technique for micro and nano fat graft. But to obtain the tissue, you need to manipulate the tissue because you are harvesting the tissue with a bigger cannula, and so you have to manipulate the tissue to fluidify the tissue. Any kind of manipulation, of course, reduce the cellularity of the tissue. And for this reason, when you treat the tissue, the adipose tissue, you have to be very delicate just to not reduce the cellularity, the stemness of this tissue. Because for me, it's extremely important to have a procedure without a minimally or no manipulation of the tissue. And so you maintain the higher amount of stemness and cellularities of the tissue.
So for most of the aesthetic practitioners or those surgical based surgeons who practice the fat injection by using the needle, I would say what type of gauge gauge of the needle we're using, always we have the blockage. Like from your presentation, the slide is show that I think the 21 gauge for 0.8, 22 gauge for 0.6, and 25 gauge needle for 0.5. So what size of the cannula hole you're using to harvest? Do you need to filter? Look at your fat tissue after harvested, you didn't filter it. Do you have an encounter with the fibrous tissue blockage while injecting?
Okay. First of all, when I use the tissue, I don't use any filter because I select the dimension of cluster from the cannula, 0.8 side port sole. Yeah. This tissue you can inject without any kind of manipulation, any kind of filter. But as I can show in the procedure, the only thing that I do is a little bit emulsification, passages from one syringe to another without any filter for 2-3 passages. After that, you can inject with cannula. My favorite cannula is a 21-22 gauge. This is a very good cannula because you can perform all the phase. When I inject, for example, in the dermal, for example, for the barcode, I can use the 27 gauge. Of course, when you use a so thin a needle, can occur that the needle clog. And so I suggest to have some spare needle because you have to change some needles because some fragment of tissue can clog the needle. But this is not so, it's not happen so often, and so it's possible to do all the procedure, very small needle.
I think few of the questions is asking this procedure actually lasts for how long?
How long?
Yeah, the effect of this procedure actually will last for how long?
Okay, for me, it's extremely important to educate our patient. You have to, because of course our patient is usually used to perform, for example, a filler. And so the question is, how long the filler is. Of course, it is a different way of thinking. This is a regenerative procedure, a regenerative therapy. And so as a therapy, you have to maintain your therapy to maintain the anti-aging effect, because I'm injecting the biological tissue. And so constantly you have to put new cells, because the other cells go to the cycle of the cell life. Anyway, I suggest, as I told you, I suggest for prevent, for example, for anti-aging treatment, sometimes it's enough 1 time a year, or for a little correction 2 times a year, but no more than 4 times. So for me, the average is 2-4 times per year. But the patient have to know that, for example, she will see the amount of result step by step, because it is an anti-aging therapy. As I show you in my presentation, I have my patient that is more than 10 years that performed the anti-aging procedure, and you can see the quality of the skin and the volume of her face is better now than 10 years before. But this is because the constancy is more important than volume. You have to educate your patient that this is not a filler. This is the regenerative therapy. And so you are doing the only regenerative therapy. Frankly speaking, when you perform the other aesthetic procedure, are more or less only a cosmetic procedure. You correct a problem, but when, for example, hyaluronic acid disappears, the condition of the patient return exactly as it was. Now, with the regenerative procedure, your tissue is getting better. You are doing something for the health of your tissue. And so is a cure for your tissue. It's not only an aesthetic procedure. Is a medical procedure.
I'm totally agree with Dr. Gennai regarding this issue, because this is a regenerative procedure. It's not like your ordinary medical aesthetic procedure. So the more you inject, the more frequent you inject, actually not necessary, I would say so. If you are injecting a tissue, as we have whatever tissue with the fat cells inside, with the stroma vesicula fraction inside, with the mesenchymal stem cell, actually you will slowly regenerate your tissue by time. The longer time you wait, the better tissue change, the skin quality will change. So there's no urgency. I see, can see the result. If you're waiting for another 5 years, 10 years, you got the chance to compare those patients who had done this or what is so-called fat grafting, nano-fat procedure. You just compare the skin texture 5 years before and after. Definitely there is still keep on ongoing changes. If that patient is greedy, they want more effect, of course they can do 2 times per year. But I'm more worried another issue, Dr. Gennai, regarding the overgrowth of the fat cell. The over volumization of the fat cell after 2 years, let's say patient have some hormone changes, patient put on weight, yes, sometimes you have to really plump up the face. So I think this is a regenerative medicine. We actually 1 or 2 sessions, you have to wait for a year or 2, see the skin texture change. And of course, the volumizing effect is not like classic fat grafting. It might have, but not as big as the classic fat grafting. I think the long-term effect, definitely, this is the regenerative medicine treatment. Definitely, it works better. There's nothing is how long it lasts. This procedure, it should last. The longer is better. The longer is better.
Correct. I completely agree with you. This is the right concept. And for this reason, I told that it's very important to educate our patient, because it's a different way of thinking. And I completely agree with you.
So do you inject this cell filler over the lips?
Of course, with a great result. A great result. We are injecting in the lip because you not only restore the tone of the lip, but you restore the quality of the mucosa, the quality of the skin. And so you have a very natural result a very enhancement, a little bit in the volume and in the quality of the skin. Very natural, the movement remains the stunning result.
Yeah, another question they ask, after 3 times a year, if the patient don't proceed, what will happen? I would say the skin will keep on changing. If nothing will happen, patient will definitely look better than the before. How does this cell hair, I think cell hair, we are not in today's topic. You want to answer from the cell filler? What is the difference from the cell filler? Okay. Another question, I think
the
maybe
concept is
hair. Maybe we skip the
no,
hair. Yeah.
Sorry?
Maybe we skip the, or maybe Dr. Gennai, you have anything?
Yeah, okay. First of all, I want to say you that, of course, a filler, we talk about the face, but of course, a filler you can do with a great result, for example, for the hands, for the female genital also. You have a very, very nice result when you have to regenerate the tissue and regenerate the mucosa. Talking about the Seffiller, the difference of the Seffiller, because of course you can, when I start to use the Seffiller for the hair, I got that it's not easy to inject the microfragmented tissue. And so with a procedure, I can transfer the stromal vascular fraction in the liquid part of the tissue, of the fat tissue. And so I inject, I select only this kind of cellularity. And so I can inject with a micro needle, a 20 gauge 4mm needle in the scalp. And so now the procedure of Seffiller is extremely painless, extremely easy, safe, and fast. The process is exactly the same, change only a little bit the preparation of the tissue.
Yeah, I think we are really short of the times. I think maybe a few of the another few questions I just asked. Can we save the harvested tissue? If yes, up to how many days we can save it?
Actually, I don't know if it's possible, but in Italy is not allowed. In Europe is not allowed to maintain the tissue. Okay, there is a bank tissue, but it's extremely complicated. In Italy, it's not possible to maintain the tissue in your facility. There is bank tissue, so you have to send the tissue in a bank, in a tissue bank, and to maintain there. Actually, I think that it's not okay. If you can maintain in your facility, you can maintain. But I have to advise that after, or you freeze the tissue, but you maintain only in refrigerator, for example, the vitality of the cells decrease very shortly after 2-4 hours.
Yeah.
After that, I think that to send to the tissue bank is not worth, because of course it's so easy, so fast to have the tissue that I don't know if it's worth to spend so many money to bank the tissue in a facility different from yours.
The issue that try not to store it, the fat tissue, because the risk of contamination is really high. Definitely is really high, no worse for that. So what is all this procedure? We make the procedure more simple way to do, office-based, simple procedure, less downtime, less risk. So I think this is today the main things. Whatever the question was asked, we are not able to answer later, we'll answer by send you all back to email. I think we had to close this session, and then maybe we pass it to Dr. Teguh to close the whole section. Dr. Teguh, please.
Thank you, Dr. Lan. So awesome, so interesting. A lot of new information performed by, of course, the speaker and you also the chairman. You are very impressive chairman, so we can get a lot of information in this discussion. Thank you for all of you participants from some countries. So hopefully this event will give you a lot of benefit for your scientific understanding and of course for your daily practice. Especially for Dr. Alessandro Gennai, thank you for your impressive presentation, your impressive idea, and very awesome novelty technology about this. From very invasive procedure to very easy procedure. So we can hopefully in every country, mostly of aesthetic doctors can use also this technology for the human being benefit. Thank you once again. See you in next Isam webinar. Please stay tuned. Bye-bye.
Thank you very much to you. Thank you. Thank you.
Thank you. Bye.